Packed into a small classroom on the 4th floor of the Guam Memorial Hospital, senators took their questions directly to the site of the problems.
I'm here to tell you, and every senator is here to tell you, once and for all, you don't have a finance problem. You have an execution problem.
That message came from the Finance Chair, Senator Christopher Dueñas, underscoring the day's central concern, accountability. Committee on Health Chair Senator Sabrina Salas-Matanani said holding the oversight hearing at GMH allowed lawmakers to see firsthand the conditions staff face every day. She made clear that communication and cutting through confusion was the priority. The agenda included vendor payments, capital improvement projects like the electrical panel and HVAC system, IT upgrades, medical supplies, cost containment efforts, and safety protocols. Dueñas noted the timing was especially meaningful for retiring GMH Administrator Lillian Posadas, giving her the chance to weigh in on these long-standing challenges.
I see a lot of signs out there that say support GMH, and absolutely, we're here to support GMH.
The senator walked through the history of legislative support, $30 million in the 36th Guam legislature, another $20 million in the 37th, and now what he called a, quote, historic $57 million budget in the 38th Guam legislature.
That will be a total of over $100 million for the Guam Memorial Hospital.
But Dueñas stressed money is only useful if it reaches the hospital and is used properly.
We're going to find out if that happened this morning. I have a feeling it didn't. And that's because when the governor first sent down the bill for the $40 million, she did not want the hospital administration to manage that money. She wanted for Department of Administration to manage that money.
Senators pressed hospital officials on the status of the $40 million appropriation approved earlier this month.
What is the status of this $40 million appropriation?
Lillian Posadas confirmed only a fraction had arrived.
That is correct. We received 1.3 million last week Friday at around 4 in the afternoon, and that 1.3 went to the payout of the doctor's pay. The doctor's pay was 1.7, but we were able then to get additional funding.
Chief Financial Officer for GMH, Yuka Hechinova, outlined the rest of the payout schedule.
So what immediately is happening right now as we speak is DOA is processing the payments for the health insurance premiums, withholding taxes, and the amounts we owe for GPA. So that is approximately $14.3 million.
Further disbursements are slated for September 30th, October 15th, and October 30th, with money earmarked for vendors, IT upgrades, and the electrical panel. But when asked if she believed the full $40 million would reach GMH before the fiscal year ends, Hechinova was blunt.
No, I did not.
You did not
No,
anticipate
I'm
that?
being realistic.
Lillian,
Department of Administration Director Edward Byrne defended the staggered payout.
The $1.3 million that we paid on Friday was an emergency request, which we got on Thursday and responded to in order that the physicians' billings could be paid, and they weren't on the AP schedule that we received. I did inform the committee at the Committee of the Whole, as Ms. Hechinova said, that all the cash was not going to be available at once. Please let me add that this is a very aggressive schedule for our cash for our cash payments.
Byrne said he remains committed because, quote, the needs of the hospital are paramount. The focus then turned to infrastructure, specifically the hospital's aging and dangerous electrical system.
But I'm hoping after this discussion, Madam Chair, that we're going to see a report back that there was at least more than just GPA on this fight. Everyone in this room is expecting all of you up front to deliver administratively on this. They got jobs to do to save lives, but we're hoping that you'll do your job to support them properly.
Vice Speaker Tony Atta pressed hospital administrators on the timeline.
I mean, what are we looking at in timeline to get the electrical system repaired?
Operations Administrator Zaldi Tugati said it will cost $17 million to fully replace the system, but only $5 million is currently set aside.
My question is, if the electrical panel failed today, what is the alternative plan for that? If the electrical panel went out today, what would you do?
I think the only perceivable alternative is to evacuate the hospital.
Chief Medical Officer Dr. Ricardo Eusebio described the current fixes as nothing more than, quote, putting out the fire, warning that without a full replacement or a backup system, the hospital remains vulnerable to a total shutdown. Other senators pushed on financial planning, uncompensated care, and infection surveillance. And new member to the GMHA Board of Trustees, Melanie Mendiola, introduced draft resolutions aimed at stabilizing GMH's finances, including a medical supplies reserve account and a proposal to right-size administrative staff. Senators left with commitments on paper, but also with sobering reminders of how fragile the hospital's situation remains. Between mounting vendor debts, outdated infrastructure, and the risk of evacuation if the electrical panel fails, the question is no longer about how much money GMH receives, but whether the system in place can turn those dollars into lasting solutions for Guam's only public hospital. Nevaeh Anderson, KUAM News.